The other observation which they made is that people with existing heart disease have a much higher mortality when they contract COVID-19. And I will show that in a graph later on. The other thing, what was observed, that some of the patients who caught COVID-19, something happened to their heart. They could either develop a heart attack, or they could get an infection of the heart, what we call a myocarditis, and secondary and weak heart. Now, we all know the symptoms by now, that if you have a fever, a cough, shortness of breath, loss of smell and taste, and diarrhea, there's a high possibility at this point in time that you may have caught COVID-19. Lesser symptoms, though, is chest pain. And what we noticed in the emergency rooms of our hospitals, and this was a learning curve, that patients often came in with breathlessness and chest pain. And we thought this was a heart attack. And later on, we actually found out this was not a heart attack, but a presentation of COVID-19. Meaning, COVID-19 can mimic a heart attack. Even when we do ECGs, we see changes on the ECGs, which can mimic a heart attack. And I think many of us in the world, including Indonesia, took patients to the cath lab to discover they didn't have a heart attack, arteries were open, and then later on when the COVID-19 tests came back, it was positive. And all over the world, actually, cath lab nurses and cardiologists caught COVID-19 and some of them died. But we learned a lot from those early days. As I mentioned, patients with COVID-19 not only can develop shortness of breath, but also chest pain. Shortness of breath and chest pain, however, can also develop when you have a heart attack. Now, another interesting observation is that because so many people get COVID-19 and the hospitals are full, the same as in Indonesia, a lot of patients with shortness of breath and chest pain didn't dare to go to hospitals. Meaning, they had a heart attack. If they went to the hospital, they could have been safe, but they stayed at home. And we noticed in all the countries in the world that the rate of mortality secondary to heart attacks went up because they didn't go for treatment. They were afraid that if they went to the hospital, they would catch COVID-19. So what can COVID-19 do to the heart? As I mentioned, like with a flu, people catch a flu. When they don't take care of themselves, the virus can attack the heart. So for instance, students who get a flu and they say, well, they run it off. It's the wrong thing to do because you may make yourself sicker and it can attack the heart. So COVID-19 can attack the heart, cause an inflammation, and eventually get a weak heart. You can present with an acute myocardial infarction because of the stress in existing coronary artery disease. And if the virus attacks the heart, you can also get fast rhythms, meaning not a normal rhythm, but a fast and pathological rhythm, like what you see on television. If let's say, a patient in the hospital suddenly gets a cardiac arrest, the doctors and the nurses jump on the patient and try to shock them out of it. And that's often the cause of death. They can present with sudden death.
Jangan lupa like dan subscribe.